This morning, we focus on a domestic war, a medical war. Just where do we stand in the battle against cancer and Alzheimer's?
This is the Emmy Award-winning 11 News Close-Up with your host, Marvin Scott.
Good morning. The statistics are alarming. Each and every day in this country, 1,500 people are diagnosed with some form of cancer. Well over 1 million new cases are reported each year, and 500,000 Americans die from the disease. As for Alzheimer's disease, it is the 6th leading cause of death overall in the United States. Over 5 million people in this country have the debilitating illness. The number of cases is growing annually as baby boomers advance in years. All this not only putting stress and pain on the victims and their families, but as well putting more pressure on our healthcare system. Now that's the negative news, but this morning's program is going to focus on the positive, advances in research and many new developments in the battle against cancer and Alzheimer's. We begin with an exploration of remarkable new knowledge in the diagnosis and treatment of Alzheimer's disease, much of it at the Fisher Center for Alzheimer's Research here in New York. Dr. Barry Reisberg heads the center's Education and Resources program at the NYU Langone Medical Center. Over the past 25 years, Dr. Reisberg has significantly advanced the current understanding and treatment of Alzheimer's. Among other things, he was the first to describe many of the most important symptoms of the disease. Welcome to PICS News Close-Up.
Nice to
Let's begin by talking about the latest advances. What's the latest knowledge you can share with us about Alzheimer's?
Well, we're learning more and more about the onset of this disease. Traditionally, we would diagnose Alzheimer's disease when people exhibit symptoms of what we call mild dementia. And this is when people would have difficulties in such daily activities as the ability to handle their personal finances, to manage their money, to write their checks correctly, to market in their accustomed fashion. If they prepare meals, to cook the meals for their family or for the holidays in their accustomed fashion. When people fall down in those kinds of activities, that's the onset of mild dementia. And until now, we scientists, doctors, have focused on persons with dementia, with mild or more severe symptoms of dementia. And we've been able to make modest gains in terms of treatment and understanding. But what's new is that in recent years, we've been able to identify earlier and earlier stages of what eventually becomes Alzheimer's disease. So
now, let me ask this. Is there a correlation between dementia and Alzheimer's, or are they two different ones? I know dementia often has been misdiagnosed as Alzheimer's, at least in 20% of the cases. Isn't that correct?
Well, dementia is a general term. Dementia is a general term for any kind of generalized deterioration of the brain, of the mind. Alzheimer's disease is a specific illness with a very specific course. In fact, the course of Alzheimer's disease can be described briefly in functional terms. Persons go on from those mild symptoms to a stage of moderate disease when functionally they begin to have difficulties not only with handling the complex activities, but they go on to have difficulties with for example, picking out their clothing properly.
Doctor, I have to ask you this because it's probably one of the most commonly asked questions of people, getting beyond the age of 50. They forget where the keys are, they can't remember someone's name, they can't remember a phone number. Is this an indicator, a barometer that this is the onset of dementia or Alzheimer's?
Well, this is what we're now learning, actually. So we call people with these symptoms, we say they have subjective cognitive impairment. They believe that their thinking is not what it used to be. But persons around them don't notice a problem. And these symptoms of subjective cognitive impairment are very common. They're
common. I just want to make it clear.
Say.
They're common, but is it an early telltale sign that one is going to get Alzheimer's?
Well, actually, this is what we're learning, that these symptoms seem to begin, these subjective symptoms, more than 20 years before dementia. And many years ago, you began by saying that I had described many of the symptoms of the disease. Well, many years ago, we posited that this was a stage in the disease, that when people have subjective impairments. And we posited that this is a stage which lasts about 15 years. And only recently, now in 2010, we published a study where we followed these people, and this is actually a few studies over the last few years. And if it's a stage that lasts 15 years, then you would expect people to go through that stage at a certain rate per year. And we followed these people over, in one study, over an average of 9 years, and we found that 60% of people, in fact, went on to the next stage, mild cognitive impairment, or worse, over the subsequent 9-year period, which is just what you would expect if this is a stage lasting about 15
What
years.
can you tell us, Doctor? What's new? What has been developed in the detection, early detection, and the treatment and cure? Well, still no cure, correct?
There is no cure.
What are the breakthroughs that we've seen in recent years?
Well, this is really what's new, that we're detecting the disease earlier and earlier.
Is there a test that people can take?
Right now, there are mainly clinical tests. There are some specialized measures, new kinds of scans, something called PET scans, where one can actually look at some of the changes in the brain. One of the hallmarks of the disease, the amyloid changes in the brain, which gives a further indication.
Wasn't there something presented at an Alzheimer's medical forum just a month ago where you use a dye and you get into the brain and it can be able to pinpoint if one is going to get...
Well, those kinds of procedures can help to some extent to say where one is in this progression. But basically, it's a clinical progression.
But is this a test that can tell whether someone is going to have Alzheimer's? Can you have early detection?
There are no tests that can tell whether you're going to have Alzheimer's early with certainty. The best measures are clinical measures. So when people go on from those subjective symptoms to when they actually begin to have difficulties with handling, for example, complex jobs, then that's another stage when they're having difficulties with complex activity, and that also has a certain prognosis, has a certain duration, and that we call mild cognitive impairment. And when we rule out other conditions, we can say what stage a person is in, and what we're beginning to do is to focus on these earlier stages by way of trying to develop treatments for those earlier stages, and also identifying risk factors for those earlier stages. And risk factors are conditions which may hasten the disease, and they're things that people might be able to do something about.
What is there? Is there anything that can protect against the disease? I read somewhere that there's a neuroglobulin that is being used to protect against it. Is this something that it's a breakthrough?
So it needs to be said very clearly that we don't have any ways of preventing this disease that have been clearly shown to be effective at the present time. We do have a lot of ideas, and we have preliminary information about certain things that seem to be forerunners, harbingers of subsequent disease. So, for example, depression is a big risk factor for Alzheimer's disease, and depression is something that we can treat. Conditions associated with poor cardiac health, all of those conditions associated with poor cardiac health seem to be risk factors for subsequent Alzheimer's disease. And those are things we can do something about.
I want to talk about genetics, and also there are many drugs on the market. Are these of any help, and what's on the horizon? We'll continue with that discussion after the break, talking about the war against Alzheimer's disease, and coming up, talking about what's the newest breakthrough in the battle against cancer. We'll be right back. Back with Dr. Barry Reisberg of the Fisher Alzheimer's Center for Alzheimer's Research, talking about advances in Alzheimer's research. There are many drugs on the market, Doctor, but these drugs are not for everyone, and it's not the cure-all. What is good and what is not good?
Well, the drugs are symptomatic treatments, and there are drugs, medications for Alzheimer's disease. There are two different kinds of such medications. One kind works on a particular brain chemical, the cholinergic system, and those drugs have been approved for treating the disease in all of its stages, from mild to severe.
Which drug is this?
At least one of those. One medication which is widely used is donepezil, which has been approved for all the stages
Effective?
of the disease. It's useful. It's useful in remediating the course of the disease and slowing the course of the disease throughout the course of the disease. There's another drug, rivastigmine, in the same class, which is also useful in most of the stages of the disease. And there's a different drug which is known as memantine, which is useful in the moderate to severe stages of the disease, which works on a different chemical mechanism, but also useful in slowing the progression of the disease. So we have medications which are now effective in all of the stages of the disease, from mild disease to moderate to severe.
So these are all advances. What about background genetics? If your mother and father had Alzheimer's, does that mean you're going to have it?
Not necessarily. If you have a mother or a father, that's called a first-degree relative, you have 3 times the risk of the disease.
An Australian doctor claimed to have a cure for Alzheimer's. Anything to it?
Well, that was a while back, and that was working on the tangles in the brain. That particular drug did not work out.
What about say work your crossword puzzles, do a lot of physical exercise?
There is data that seemingly by using your brain, people with higher education seem to do better, but since we're using tests to measure the disease, there's a major confound there. So it's not proven, but a lot of people believe that.
Can you voice any optimism that a breakthrough, that a cure, some treatment for this early diagnosis is on the horizon?
We're learning a tremendous amount about the disease. We've only